Assalamualaikum and good day to everyone. My name is Siti Munirah Binti Abdul Wahab. I'm from Faculty of Health Sciences, UiTM Cawangan Pulau Pinang, Campus Pertam. I would like to present my topic about critical care nurses involvement and barrier in palliative care. I'm present this for International Conference on Interdisciplinary Research in Social Science and Technology 2022. Thank you to Kaiser Renovation Center for this opportunity. This is my contents. For the introduction, palliative care focus on holistic treatment, including first psychological support or spiritual support, symptom control, care plan treatment, and preparation for the possibility of death. According to Wahab and May 2013, nurses enact roles of confident educator, advocate, culture, license, and translator, at times attempting to mitigate conflict between the patient and family, between the family and physicians, and between clinicals in the ICU. Nurses are often not involved in discussion of prognosis, goal of care, and palliative care. The barrier to nurses participants' involvement were insufficient education of nurses, physicians not asking for nurses' involvement, and the emotional toll of involvement in discussion. For the problem statements, one of the problems nurses face in Malaysia is that palliative care does not usually practice in the critical care units. Nurses are often set aside and are not given a chance in the family discussion, which is a part of palliative care activity in critical care. The effect is often misunderstanding and less effective treatment of palliative care at the end of life care. Palliative care was provided to all chronic patients and required a long time to recover, especially elder patients. This is my objective. I have two objectives, which the first is to determine the frequency of critical care nurses' involvement in palliative care. Second, to identify the barriers critical care nurses perceive to their involvement in palliative care. Now, we look for the literature review. Frequency of critical care nurses' involvement in palliative care. At the University of California, one study stated that 45% were or never participating in family meeting discussion. And Zhang et al. 2015 showed in their study that the nurses not confident in an activity contributing participants in family meeting, obtain information from a physician to understand patient goals of care and communicate the value of care consultation to a physician. And for the very critical care nurses perceived to their involvement in palliative care, some literature review stated that the most common perceived barrier to referral by pediatricians was the lack of accessible palliative care service in Malaysia. And according to Wong and Tisai 2010 stated that only 1/3 of nurses in the critical care unit showed moderate pain knowledge management for palliative patients. Jared and Hamid summarized that some factors nurses are no time in family discussion because of the shortage of staff, frequent newcomers, and lack of management support. Now we go for the methodology. This is a descriptive and cross-sectional study. The study was conducted in the Critical Care Units Hospital Pulau Pinang, which involved with the General Intensive Care Units, Coronary Care Units, Pediatric Intensive Care Units, Neuro Intensive Care Units, about 157 nurses, which is nurses working in critical care units involved. The sample being identified using convenient sampling with the inclusion criteria and exclusion criteria as stated. The instrument for this study was adapted from the research paper ICU Bedside Nurses Involvement in Palliative Care Communications, a multi-center survey by Anderson et al. 2016. This questionnaire consists of two parts of 37 with 37 questions. The total combo alpha result was 0.80 in which a goods, which showed that the consistency of the data was good. The questions were validated and assessed by 3 experts, 2 consultants and 1 nurses manager with Master of Critical Care from Hospital Pulau Pinang. All data was entered and analyzed using SPSS version 24. For the ethical approval, the research had approval from Research Ethics Committee UITM and registered under NMRL through CRC. For the data collection begin from 4 May 2020 until 4 August 2020. For the results, this is the demographic characteristic of the respondents. It shows that most participants was the youngest, 20 to 30 years old, and more females than males, and most participants had diploma in nursing, and 66.9% had 1 to 9 years in nursing experience, and almost 85% had 1 to 2 years working at intensive care units. Now we look for the objective 1's results as the frequency of nurses participants in palliative care. In this study found that 24.2 nurses often engaging in discussing with family patient goal of care. For the next questions, do you discuss with the physician prognosis of the patients? Only 26.8% were often discussed with their physician. However, 19.1% of the nurses never attended family meeting. And 16.6% never participated in palliative care consultation with family. For the result objective 2, as for the barrier nurses perceive to their involvement in palliative care. Most of the participants agreed that they needed more training in palliative care. About 63.1%. About 68 of them agreed and strongly agreed that the physician did not ask for their perspective in palliative care. 62% agreed that their involvement in palliative care discussion was emotionally exhausted. However, most of them were disagree that they don't have time for bedside discussion of prognosis, where it shows about the 63%. About 89.8% disagree that their manager do not support their involvement in this discussion. And at last, 86.6% disagree that the physician have negative reaction to palliative care as their perceived barrier to their involvement in palliative care discussion. Now we go to the discussion and conclusions. For the discussion, in this research finding revealed that the most respondents reported that their engagement in discussion of prognosis, goal of care with the physician and family, and the participate in palliative care consultation with the family was very important to the quality of patient care. This research finding result is similar with the Andersons et al. 2016 and Fox 2014. And Zhang et al. 2015 show in their study that nurses not confident in and active contributing participants in family meetings, obtain information from a physician to understand patient goal of care, and communicate the value of care consultation to a physician. For the second objective, John and Khaled, the authors stress that urgent need to enhance education and training for the misconception and lack of practical perspective of healthcare provider that will compromise the care of patients with the life-limiting illness and their family receive. And then Jared and Hamid summarize that some factors nurses have no time in family discussion is due to the shortage of staff, frequency in newcomers, and lack of the management. For the conclusions, this study using a cross-sectional method to determine the frequency of critical care nurses' involvement in palliative care and the barriers critical care nurses perceive to their involvement in palliative care. The findings reflect the deep desire of critical care nurses to be involved in palliative care in ICUs in this part of the world. It will help to strengthen the practice of multidisciplinary PC treatment in the critical care units. The result of the study is intended to be shared knowledge that will lead to changes in the treatment of dying in all of these countries. This is my references. Thank you everyone for listening. Bye.